75% of all infants born in West Virginia are receiving nutritional services through a program called WIC, which stands for the Supplemental Nutritional Program for Women, Infants, and Children. Its purpose: to help pregnant women, new mothers, and young children eat well and stay healthy. The program also serves as a third of all pregnant women and 1 in 4 preschoolers in the state. Yet, there are thousands more in this population that WIC is trying to reach. To tell us more about that is Melinda Lendon, Assistant Director of the Office of Nutritional Services WIC program. Melinda, thank you for being here.
It's nice to be here. Thank you.
We talked a little bit about what WIC was. Just sort of in your own words, can you talk about why it's so important for anyone who's eligible to get WIC benefits?
Sure. It is completely important in order for children to have the best start in life. Kids that are on WIC from by the time they're in the womb till they're up to age 5, they have a better start. They're healthier. They choose better foods, more nutritious foods, and just basically it gives them a better start.
You know, we know nutrition is important. In our prior segment, we talked a lot about childhood obesity and the importance of just as early as possible getting parents thinking about what is the appropriate nutrition, and especially pregnant women.
Yes.
You know, I know it's difficult, for people to understand always that we need to really, push the effort to get people to come in when they're pregnant. And there's a reason for that, right?
There is. A lot of people don't want to accept WIC. They think that it's a welfare program, but really WIC is just a helping hand. Right now, with the current food list, it's anywhere between $42 and $125 in food benefits that participants can receive. In addition, we provide nutrition education, referrals to other programs, immunization screenings, breastfeeding support, access to our farmers market. There's a whole host of services that including pregnant women can get in order to start them on a healthier outcome for kids.
Right. Now, I know that a lot of people ask about funding, and you talked a little bit about the amount that they could receive per month in terms of nutritious foods and things that they would need as a pregnant woman or that their children would need. How is this funded? What is the funding source for WIC?
WIC is funded through the USDA, which is the Department of Agriculture, and funds are given from them to DHHR, Bureau for Public Health. From there, we contract with 8 local agencies, 5 of which are county health departments, to manage the 57 clinics that we have statewide. Our caseload, depending on whether it's high or low, dictates how much funding we get. Currently, we're at around $40 million for fiscal year 2016 funding that we can turn around and manage the program on the state side and also provide food benefits to participants.
So this money comes from the federal government through the Agriculture Department directly to us for that purpose. Now, I know that we contract out those services, and we do that for I think a very important reason. We want it to be local. Is that right?
Exactly, exactly. We want to employ local people in each of these counties. It's particularly the southern counties. They are feeling, a lot of job losses, with coal.
Some challenges,
so, yeah,
absolutely.
That's where it kind of gives them jobs to come in and work at the clinics. I mean, we've got registered dietitians, we've got nutritionists. A lot of people have master's degrees working in these clinics, so they know WIC. Many of our employees have been with WIC for 30 years. So
I think that is important to know. Now, how easy is it for individuals to access a WIC office? I know they are located in different places, in different counties, in different part of the states. Is there a website people can go on to determine the closest location to them?
There is. If you can either do a Google search for WIC, West Virginia WIC, or just go to ons.wvdhhr.org. From there, you can look it up by your county, and that will show you the address and the phone number for whichever county that you live in and the closest area that you can get served.
Now, approximately how many people are served for this program across the state?
It is approximately 41,000 per month that we see and have access to. Of course, that number could be higher, but 41,000 is nothing, short of, that's great. I mean, that we can serve that many people. So.
Now, how do we, we have some goals, obviously, that we want to lay out for 2016, and I think one of those goals is to really reach out and ensure that people who are eligible come into our office to get the benefits, because we know that's,
right,
as you pointed out, a great start for our
yep,
children,
yes,
and we want them to be healthy. What types of goals do you have in place to really help with those outreach efforts?
We are focusing this year in particular on our children caseload. They are 50% of our caseload every single month, every year, yet it's the largest category could be, ages 1 all the way up to age 5, but we're only hitting 50%. So we are working in collaboration with our community partners right from the start, Birth to 3, Head Start programs, trying to reach out to get referrals from them, because people need it. People need to know what WIC is and that we're here to provide the services.
Are there any other specific goals that you've set? We know we want to reach those preschool, the
yes,
small children, trying to work with our partners to do that. What other goals do you have that is really a focus for 2016?
We are actually just finishing up a media campaign from this past year, and we are focusing on trying to look at to jump into a nationwide campaign that is going to reflect the same message that WIC is available in every state. We may have, different food lists, etc., but the main goal is that people get seen.
And I think, again, that's very important, because we know that it's critical that our children have a healthy start in life, and this is a good way to do that. It's exciting to think that, we're partnering not only with our local agencies, but with the national WIC
yes,
campaign to be able to really get the word out.
Yeah.
And so I think that, as we go forward, it's going to be critical for us to all continue to focus our energies on, healthy living for our families,
yes,
which includes healthy living for our children. Are there particular outreach activities that you do in hospitals, when babies are born, so that there's an opportunity for people to learn about WIC as a benefit for those individuals?
In particular, our breastfeeding peer counselors in many of our agencies, especially in Kanawha County and Cabell County, since that's where larger hospitals are, they will go in directly and provide the moms with any breastfeeding support to try to explain to them what WIC is. And even some that don't sign up for WIC, they still somewhat help, because breastfeeding, of course, is the number one way to nurture their children.
Right.
They also provide services to educate them on nutrition and the goals of the WIC program. So,
all great things,
yes,
and it's very exciting to see that we have this campaign and that we're working at reaching out to both pregnant women, babies as soon as they're born in the hospital, as well as our children, our toddlers in our preschool. Yep. Thank you for the work you do and for the partners that are out there doing the work.
Thank you.
That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the Department of Health and Human Resources. Thank you for watching The State of Health here on the Library Television Network.